also like the treatments and stuff that she needed to have in the acute phase. We're going to kind of go along and continue on. This is when she was on 9 feet and she was relearning how to do things like how to walk, how to eat, how to swallow, physical therapy, occupational therapy saw her, and she was only there for a couple of days before on day 18 she was finally discharged from AGH to UPMC's Mercy Center for Brain Injury, where she stayed in inpatient rehab. Like I said, the first thing that she remembers was being at rehab, which is really interesting considering she was up, walking, talking, eating, but for some reason she just has no memory of that. So on the 16th, September 16th, she returned to AGH for her cranioplasty, which was the replacement of her left bone flap. 5 metal plates were used to join it to the remaining portion of her skull, and her neurosurgeon was Dr. Aziz in that picture. But she has had some complications which are very common with brain injuries, especially ones as severe as hers. So she has been having seizures, and she was admitted to the hospital for a few days to monitor her, do a couple of tests, and start her on some medication. She did have an infection of one of the metal plates in her head, so she is on 6 weeks of IV antibiotic therapy. She's also been having some alterations in taste and smell, as well as some small memory things here and there. But obviously, as I've shown you before, I mean, Meg is a very determined young woman who, has gone through so much. I mean, she really has done so much for herself, so she was able to put herself through this. And I think a big part of it, to be honest, has to do with her support system. Now, part of our job as nurses is to not only take care of the patient, but to take care of their families during these very traumatic times. And this was such an unexpected thing. I mean, she was such a healthy person, and just for it to happen out of nowhere. I'm sure we've all been in the place where family members take out, say, their frustrations on the nurses. So to actually be able to work with a family and friends who were so supportive and caring, and they were so appropriate, I mean, I can't even begin to describe how much of a pleasure it was, because especially in the trauma ICU, we don't get very supportive family members very often. So, like I said, they were in and out constantly, people always there. It was really, really refreshing from my end. And, they even did a thing on the Caring Bridge. There's a website called thecaringbridge.com where you can create a site, and they can blog about it, and it brings support together. And so it was really interesting for me to find that and read, because they went day by day, and they had different people writing it, family members, friends, giving updates so that everyone could stay informed, and, they could bridge together to support Meg through this, because obviously, I mean, this is a big thing, and you can't do this on your own. So you can see here in some of these pictures, she's just had so much support from even staff members, and I mean, I've heard so many people talk about how much of a joy and a pleasure it was to work with her. So, now, after you've heard about her injuries and everything that she's gone through, I'm so excited and happy to be able to actually introduce you to Meg. She's here today.
First of all, thank you for that welcome. Thank you, and for me. Nurses, doctors, medical staff, friends, and family. My name is Megan, and it's my honor to be here to speak to you all today. I'm a second grade teacher, collegiate Hall of Fame swimmer, 7-time half Ironman, and 2-time full Ironman triathlete. The kind of training I'm used to involves months of physical and mental preparation for swimming 2.4 miles, cycling 112 miles, and running 26.2 miles. It's grueling, but the finish line is sweet. Now, as a survivor of traumatic brain injury, I am focused on a different kind of finish line. And I couldn't imagine having a better team of doctors, nurses, medical staff, family, and friends supporting me on this journey and cheering me on along the way. You hear of these things happening to other people, but you never think they will happen to you. You never think words like skull fracture, breathing tube, neurostorming, brain surgery, or seizure will be used to describe you. But 3 months ago, these were the words my family heard on a daily basis to describe my condition as a coma. As you know by now, on August 4th, I was brought to the HEH trauma unit after a cycling accident. It is because of the extraordinary doctors and nurses here at HEH who took care of me that I can dream of crossing not only the TBI finish line, but also the triathlete finish line again one day. I often find myself at a loss for words to express how I truly feel, and somehow thank you doesn't seem to be enough. How do you ever thank the people who saved your life? It is truly overwhelming to try and express my heartfelt thanks and appreciation to all of you. Although I don't remember much of my stay here at HEH, I am lucky to have such supportive family and friends who never left my side and who have recounted story after story about the amazing doctors and nurses who took care of me around the clock. Nurses who went above and beyond the call of duty, voluntarily staying past their shifts to give extra care, patiently explaining complex and scary medical conditions with compassion and kindness, and giving hugs to parents and siblings fearing the unknown. And doctors who insisted on not shaving my entire head. Thank you, Dr. Aziz and Dr. White. Called worried family members while on vacation to reassure them, enlightened pre-surgery preparations with a smile. My first post-accident memory was discovering some sort of mittens on my hands. I didn't remember much from here, but I was told this, and my family kept referring to them as boxing gloves. I couldn't imagine why I was wearing boxing gloves. It wasn't anywhere near a boxing ring, but was sitting in a hospital bed. Little did I know I needed those so I didn't hurt myself or try to get out of bed and go for a swim. Not long after this, I remember being taken away in an ambulance to inpatient rehabilitation, my first real memory, which I thought was completely unnecessary. I would rather have been on my way to Ross Park Mall to go shopping, even in an ambulance. But when I got to rehab, I quickly progressed and spent only 9 days there. I attribute this to the extraordinary care that I received here at HEH in the initial days after my accident that prepared me for the daily rigors of physical, occupational, and speech therapy. Since returning to my parents' home at the beginning of September, I've regained confidence in my ability to carry out daily tasks. In inpatient rehab, it seemed like it would be months before I could do these things, like independently take a shower, or prepare a meal, go for a daily walk, go to dinner with my friends, and send emails. Today I can do all those things, but I still have some work to do. I dream of the day when I can fully taste and smell my morning coffee. We're getting there, though. When I have the physical strength of Iron Man again, and when I can wake up in my own home and go for a morning swim before driving to school to teach my students. I not only dream of these things, but thanks to you all, I have a renewed chance, a new and more positive outlook on life, and the ability to accomplish these goals and cross this finish line. I would like to thank my amazing family, especially my parents, who have been on my side the entire way, all my life, and my friends, who have been there for walks, talks, and encouragement. I've heard that a strong recovery is made even stronger by a loving and dedicated support team. I am so blessed to have what I consider to be the best support both at home and at HEH. I especially want to thank all of you for the fantastic, life-saving team that you make each and every day. There are a few people in particular who I'd like to mention. All of the nurses in the trauma unit, the neuro ICU, and on the patient floors. In particular, Shauna, Jim, Andrea, and Caitlin. Although I've only briefly met you, my family mentions your name over and over again, and I am eternally grateful for your compassion and care during some of the most difficult days my family has faced. My friend Megan Bellotti, who was riding with me on August 4th, and whose quick thinking landed me here at AGH. Dr. White and his team for making sure an infection and a stubborn wound didn't get the best of my bone flap. Troy, Dr. Aziz's physician's assistant, for his persistent reminders of what I need to do to get back in the fold. Not of least, which is eating like a true swimmer. Diane Cantella and Cindy Green. You have truly gone above and beyond and become friends and heroes of our families. We don't even have to tell you when we are going to be here at AGH for a follow-up visit or surgery, and all of a sudden you were there, speaking words of encouragement and giving us hope that everything is going to be okay. And Dr. Aziz, I can never truly convey how thankful I am that you and your team were at AGH that Sunday morning. Like I said the first time I met you, thank you for saving my life, and thanks again for saving my hair. That's the last time I saved our car. Thank you a million times over. In closing, I'd like to leave you with a quote that one of my coaches and mentors shared with me just the other day. It speaks not only to my recovery, but also to the importance of the job that you all perform so selflessly on a day-to-day basis, and the lives you touch in the process. Each day we are born again. We do today what matters most. Thank you all.